the head of disease surveillance in Mombasa County. So let me share my slides. Okay, I hope you can see. So the topic of today will be an introduction on disease surveillance. Sorry. I'm trying to. Okay. So the topic of today is on disease surveillance, and our main objective is to define public health surveillance, list some of the uses of surveillance data, describe the data sources, describe different types of surveillance used, and describe case definitions, discuss role of lab in surveillance, and list some of the priority diseases in Kenya. So generally, when we talk of surveillance, it's an act of watching or attentive observation, which is used to oversee or direct or to assess something, and with an aim of gathering data or information. So generally, surveillance, it's a wider term that is being used both in different sectors, including the security sector. But for today, we'll only be concentrating on the public health surveillance. So what is public health surveillance? Generally, public health surveillance, public health surveillance, as it was defined by the WHO, it's an ongoing systematic collection, analysis, and interpretation of health-related essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of this data to those responsible for prevention and control. So all this, it's the term, this defines what is surveillance. But in short, what you need to take home, or your take home for the term public health surveillance, is data for action. So whatever you do, whatever information that you are gathering from the patients, from the community, you need to take action from this data. That's when you will say that you have, you are implementing or you are conducting surveillance. So there were some few things that we looked at there, whereby when we defined the surveillance as per WHO, but also we had another definition for public health surveillance, which is less wording and it's direct forward, whereby we say that public health surveillance is the ongoing systematic collection, analysis, interpretation, and dissemination of health data for public health actions. So as I've said it earlier, whatever data you are gathering, it should have a public health action out of it. So in the components of surveillance, which results in public health action is, when we talk of surveillance, that means you collect data. After you have collected data, that is related to patients, that is related to community, but at the end goal, it talks about health events. After you have this data, you need to do analysis on this data. After you do the analysis, you interpret, what does this data tell me about this community in terms of diseases, and after getting the interpretation, you need to disseminate this data, or you need to give feedback to the people who have collected the data, and also to the community or the area that you have collected the data from. So generally, public health, from the interpretations, that's when you public health actions come up. And when we talk of public health actions, the priority settings for public health actions are, we need to do planning. You can do this from the data that you have interpreted. You can do like you can implement a control measures, or you can evaluate any disease trends that you have reported or you have been investigating about. So by the end of it, what we mean is, during the data collection, you need to look at, in terms of public health actions, you can either do further investigations, you can come up with control measures, or you can come up with prevention measures. So when should you do the investigations, when should you do the control measures, and when should you do the prevention measures? So you do investigations when you feel that you have surpassed your actions, you have surpassed or you have reached your alert thresholds. You do control measures when you confirm that there is an existence of an outbreak, So you need to come up with the prevention measures to stop further spread of this outbreak. And also you can do prevention measures to prevent further spread of these diseases to the community or to the larger population who are yet to be exposed to this disease. So generally, what is contained in the definition of public health? So here, what we mean is, when you define public health, what should it not miss? So surveillance is supposed to be systematic. Okay, it should not be an ad hoc kind of activity. Surveillance should be a systematic, whereby you know that we need to collect data on routine basis, and it's an ongoing thing. Simply because when you do an ongoing or you do it as a routine, you can gather that information and help you make informed decisions for the type of, for that particular disease that we are trying to investigate. Then it should be consistent and generate data. So as I've said it, we don't need, when you are doing surveillance, it doesn't mean that today you do surveillance for certain activity, for certain disease, then you leave it out. After some 3 or 4 months, that's when you do another surveillance for that particular activity. So whatever you'll be doing by that time, it will really not be a surveillance as per se. So then the other key component for public health surveillance that should not miss is the issues of data collection. You should collect data. If you are doing surveillance but you are not collecting data, then that means it's really, you are not really doing surveillance, because the data that you are collecting, they're the ones that can come up, that can alert you when we have reached an alert or action thresholds. When should you respond? When should you do an investigation? So data collection is a key component that should not be missed when you're doing public health surveillance. So as you're doing data collection, you should be able to know who is your case, like what am I collecting? Which data am I collecting? And not all cases need to be collected or need to be in there to be under surveillance. So for the last point on not all cases, we just need to have the same type of diseases every day. So on not all cases, there is what we call as a case definition, which is used to identify which case should you do collect or should you do surveillance on. So when we talked of the key components, we talked about the systematic nature of surveillance, the data collection component, and now after you have done your data collection, have done your interpretations, you need to link what you have, or you need to link that data to action. So how can you link your data to actions? So the data that you have collected using a systematic method or systematic manner can tell you that you need to do an outbreak investigation. So here, what does it mean when it tells you that you need to do an outbreak investigation? It means that you have surpassed the alert threshold. So I think for the issues of alert actions and action thresholds, it's another topic on its own that will incorporate in the future. But when you're trying to collect data, you need to know if you can do an outbreak investigation, depending on the analysis that you have done. And then this data can also tell you if you need to do disease control. So when we talk of disease control, there are several issues, there are several activities that can be undertaken under disease control. That include vaccination, if it's a vaccine preventable disease, or the use of prophylaxis. Then you can also do disease control by eliminating a cause or the source. For example, if it's a point source for cholera outbreak, you just need to come up with your action of preventing further spread of this disease by eliminating the source. Or you can interrupt transmission. For example, the use of mosquito nets. So that's how you can come up with the disease control actions, or that's how you link your surveillance activity to actions. So also with this, the other way of utilizing the data for surveillance is whereby you can develop targeted programs. For example, when it's an outbreak that is related to waterborne diseases, you need to come up with health education on risk reduction for any that are related to water, that are related to water, or food. So also, the actions can be tailored towards development of policies or regulations. So that tells us that surveillance is something that is systematic, ongoing, and it really it can come up with a lot of actions depending on the type of data or depending on the type of conditions that you are monitoring. So, according to Foig et al., in the International Journal of Epidemiology in the 1976, it says that the reasons for collecting, analyzing, and disseminating information on disease is to control that disease. So there's no need that you need to collect data and analyze it if you don't want to control the disease. So the reason is that you need to collect that data so that you can control the disease, and collection and analysis should not be allowed to consume resources if actions does not follow. So here also it summarizes what I've just presented when I was doing my first presentation, whereby we say that data surveillance is data for action. So what are the roles of public health surveillance? First of all, the surveillance produces data for decision-making and action, as I've taken you through how we have defined surveillance. So when you're doing surveillance, you need to know what is the problem. So what is the disease, a condition, or what is the public health event that we are interested in? So when you get to know the problem, you go further and understand which are these risk factors. What is causing this disease? What is causing this public health event that we are experiencing? So when you are doing that, that means you are doing surveillance. So if you have identified the risk factors, you need to go further and understand how can you come up with interventions, or what works well for you to control or to prevent the cause that you have just identified. And then if you know what works well, then you need to know how do you do the implementations. So surveillance, it's all about identifying a problem and coming up with a response. So what are the uses of public health surveillance? In summary, what we are saying is the uses of public health surveillance is to establish a baseline rate of disease, or to know the magnitude of a problem in the community. As I've said it, surveillance is an ongoing systematic or routine data collection. So when you're doing the routine data collection, you get to know, like in the month of between April or during the rainy season, we expect to have 300 malaria cases in this facility. So you know your baseline rate in terms of diseases, or you want to know the magnitude, like how rampant is this problem in the community. And then after that, the other use is you need to detect sudden changes in disease occurrence and distribution. So when you are collecting the data, assuming you expect that for this particular area, like let's say Mombasa, we expect to have 1,000 malaria cases per month. But all of a sudden, you get to see that you are reporting 3,000 cases. So that's really shows a sudden change in disease occurrence. So because of the surveillance data that you have been doing, or because of the surveillance activity that you have been doing, then you can detect that there is changes in terms of disease occurrence. They have shifted from 1,000 per month to 3,000 per month, or 3,000 per week. So that's the role of, or that's the importance of why we need to have a public health surveillance in our healthcare system. Also, we are able to monitor trends and patterns of diseases. As I've said it, in terms of the months also, you expect, like during the dry season, for example, the northern counties, after the long rains, we expect the outbreaks of we are at higher risk of RVF outbreaks. So that's for the northeastern counties. For us in Mombasa, we can also look at our trends for these particular diseases. Like during the rain season, we expect that there's some we expect to get the real outbreaks. Also, the disease surveillance, the use is that it helps us in portraying the natural history of diseases. It can help us in generating hypotheses and stimulate research, because we talked of which are the risk factors. So that's when you come up with, that's when you generate hypotheses. Also, it helps us in monitoring changes in infectious agents, like we have been experiencing, whereby you